And joining us from the University Hospital studios is Dr. Andrew Sloan, the hospital's director of the Brain Tumor and Neuro-Oncology Center. He is also the medical director of neuro-oncology at UH. Dr. Sloan, thanks for joining us this evening.
My pleasure.
Primary glioblastoma, what is it and potentially how aggressive is it?
It is the most common primary malignant brain tumor, accounting, and also unfortunately the most malignant. It is a fairly malignant tumor. Median survival is about 14 to 15 months in general, although over the last 3 years, given a number of experimental therapeutics and new advances in treatment, survival has been creeping up. And I always tell my patients, don't think about the averages, think about what's best for you. We have many, many patients who are doing far better than average today.
Certainly. Now, Senator McCain will be 81 years old next month. Does age play a factor in his treatment at all?
Well, age has traditionally been a prognostic indicator, and older people sometimes don't do as well. But I think age is relative. I don't know McCain, but he's always been a very hardy individual. He's known for his endurance and his toughness, and I wouldn't cast him aside given his age. I would say that if he wants to fight it, I would encourage him to do so.
Dr. Sloan, last month we saw Senator McCain question former FBI Director James Comey in that Senate hearing, and Senator McCain seemed discombobulated. He seemed out of it. Knowing what we know now, could that tumor that was in his brain been a factor in his brain function in the way that he performed that day?
Particularly if I'm the director of the FBI.
Well, I didn't see the interview, but the tumor, as I understand it, is on the left side, and for most right-handed people, that's the side that is regulating language. So that may very well have been a factor. Also, the frontal lobe, which is where I understand the blood clot was, and presumably the tumor is, also controls executive functions such as thinking, organization, things like that. So it may very well have been a factor.
I see. Dr. Andrew Sloan of University Hospitals, thank you so much for your insight. We appreciate it.
My pleasure.